Anup said, today we are going to learn about lymphedema management. This is another nursing issues in palliative care, one of the major one. So we all know that lymphedema is related to lymphatic system. So I would like to discuss few things about lymphatic system and then move on to the lymphedema part. So let me share my screen first. I hope my screen is visible to everyone. So, as I mentioned earlier, lymphedema is related to lymphatic system. Throughout the lymphatic system, the lymphatic fluid, like lymph, is flowing. Okay. So, before moving to the lymphatic system, we have to learn about what is lymph. So, what is what is the content of lymph? Okay. So, lymph is a tissue fluid or an interstitial fluid. So if there is an interstitial space there, definitely the lymphatic fluid will be collected. Okay, so that fluid is collected through the lymphatic capillaries, then enters into the lymphatic vessels, okay, to lymph nodes. So wherever the lymphatic fluids is origin, with the help of the lymphatic capillaries, it absorbed from the interstitial space and then it goes to the lymphatic vessels, finally then to the lymph nodes and then finally to drain the subclavian vein. We will discuss later about that. So the lymph contains protein, lipids and water. So it is a tissue fluid or an interstitial fluid. So this is called lymph. So what are the functions of lymphatic system? So I would like to hear from you all. So what are the major functions of lymphatic system? So please put your answers in the chat box. Any answers? So I am waiting for your answers. What are the major functions of lymphatic system? Anybody? At least one. Lymphatic system collected infections. Okay. I'll come to that later. Any other answers? Mehboob ma'am?
Yes, it's a part of immune system.
Your voice is not audible. You repeat again.
It's a part of immune.
Okay, immune system. Okay. Thank you. Any other answers? So very good. Thank you. Thank you for your answers. The first, the main function is reabsorb excess interstitial fluid. So as I said earlier, so wherever throughout our that body, so there will be tissues. In between the tissues, that interstitial spaces, the tissue fluid, the interstitial fluid will be there, no? So wherever the lymphatic fluid is origin, that lymphatic capillaries will be absorbing. That is why, so our fluid, electrolyte and fluid balance is maintained well. Otherwise, that whole body edema will develop. Okay. So the first, the aim function of lymphatic system is reabsorb excess interstitial fluid. The second the function is transport dietary lipids. And the third function is, as madam is mentioned earlier, lymphocyte development and the immune response. Okay, so from these functions, you have to understand that if there is any damage or any problems developed in the lymphatic system, these all things will be affected. Okay, so that is why I bring these functions into this class, because you have to learn first this, and then you have to learn what is lymphedema. So this is our systemic circulation. We all know that how our system is function, and how our that circular blood is how the systemic circulation is happen. So here you can just see that upper part of the body. So upper part of, wait a minute. So here from our upper part of the body, so the superior vena cava will be collecting the deoxygenated blood. Okay, here you can see the superior vena cava will be collecting the deoxygenated blood from the upper part of the body. So here the venous capillaries and the arterial capillaries are communicating together. Without that, it doesn't happen, no? So here the superior vena cava will be collecting the impure blood from the upper part of the body, and the inferior vena cava will be collecting the deoxygenated blood from the lower part of the body. Here also there is a connection between the arterial capillaries and the venous capillaries. Okay, so just keep it in your mind. There is a connection between the arterial capillaries and the venous capillaries. So from that inferior vena cava and the superior vena cava will be drain that deoxygenated blood into the right atrium, right? From the right atrium, it goes to the right ventricle, and then with the help of right pulmonary artery, not right, pulmonary artery, it goes to right and left lung. Okay, for purification of blood. So here also within the lung, there is a connection between the arterial capillaries and the venous capillaries. You can see that. Okay. So from this picture, you have to understand that there is a connection between the arterial capillaries and the venous capillaries. Okay. So let's see what is happening when the arterial capillaries and the venous capillaries are communicating together. So here you can see if the arterial capillaries and the venous capillaries are communicating together, there is a fluid-like material oozing out. So that is called lymphatic fluid. You can see that greenish color. Okay. So that fluid will be absorbed with the help of lymphatic capillaries. Okay. You can see the right side picture. So it is a clustered form now. So wherever the fluid will be drained, fluid is drained, that lymphatic capillaries will be collecting the lymphatic fluid. Okay, so that lymphatic fluid is origin from the that interstitial space. So let's see one by one what is lymphatic capillaries. So the structure of lymphatic capillaries, it has a blind end, single layer of overlapping endothelial cells. You can see this picture, it is a overlapping endothelial cells, and more permeable than that of blood capillary. So that because large molecule also they can the lymphatic capillaries are able to absorb. Coming to the lacteals. So I already mentioned the second major function of lymphatic system is transport dietary lipids. Here, the small intestine contains special type of lymphatic capillaries called lacteals. We all know that. So lacteals, what is the function of, what is the major function of lacteals? Lacteals is pick up the interstitial fluid and also they absorb the dietary lipids. Okay, so lipid soluble vitamins also they absorb. So that is why we say like it has a function of transport dietary lipids. And the third major function, the third thing is, so it look like a, because of the lipid, it look like that part of lipid, the lymph fluid look like a milky color. That is why we call chyle. Okay, so this is, you have to understand that this is another that form of the small intestine function. And the moving on to the lymph nodes. From the lymphatic capillary, the lymphatic fluid goes to the lymphatic vessels and then it tenders to the lymph nodes. So from in our body, it's around 600 to 700 lymph nodes are there. Here, so in between the pathways, because one lymph node will be there and the another the thing is lymphatic vessels, again one lymph node will be there, so that kind of connections will be there. So the length from 6 to 25 millimeters, typically found in clusters. Okay, the major function of a lymph node is receive lymph from the many body regions. Okay, so here as I mentioned earlier, so these lymph nodes are also found in individually throughout the body tissues. That is why I mentioned it's around 600 to 700 lymph nodes in our body. So from this picture, you can understand that. So in between the lymphatic vessels, so there are many lymph nodes are situated. Let's see what is the function of lymph nodes, how the lymphatic system works. So this is very, very important. The lymphatic system, throughout the lymphatic system, circulate protein-rich lymphatic fluids throughout the body because that will collect bacteria, virus, and waste products. Okay, so wherever the lymphatic fluids origin, the lymphatic capillaries will be absorbed because it has a blind end and more permeable than the of the blood capillaries. So it sometimes it might be contain bacteria, virus, and waste products. So what happened next? After absorption, the lymphatic system carries these lymphatic fluids into the lymph nodes. Okay, so the lymphatic capillaries absorb the lymphatic fluid from the interstitial space and then it goes to the lymphatic vessels and then it goes to the lymph nodes for filtration. Okay, so the lymph node will be filter out the harmful substance. So that is why, so if there is a virus or bacteria will be there, that time the lymph nodes will be fight against the bacteria or virus. Okay, it will try to prevent infection enter into the body. So then after that, the waste are flushed from the body and clean the lymph fluid into the clear part of the lymph fluid into the bloodstream. So that is the pathophysiology. Okay, so from the lymphatic vessel, the interstitial space, the lymphatic capillaries will be absorbing. From that lymphatic capillary, the lymphatic capillary push the fluid into the lymphatic vessels. From the lymphatic vessels, it goes to the lymph node. Into the lymph node, the filtration will be there. Filtration, that the lymph node will be filter out the harmful substance like bacteria, virus, or any other infections. And then it will flush out the waste product from the body, and then the clear lymphatic fluids is pushed into the bloodstream. So you can see lymphatic capillaries, then lymphatic vessels, then lymph node, then lymphatic vessels, lymphatic tract, then collecting tract, then the last thing is subclavian vein. So finally it goes to the subclavian vein. So that is why we learn the lymphatic system is also is a part of circulatory system. Okay, so the lymphatic fluids will be finally drained into the subclavian vein. I hope that anatomy part is clear to everyone. Any doubts so far? Any doubts? Clear? Yes or no? So I would like to see you all. Please switch on your video. Thank you. Thank you. Any doubts so far? Clear?
Can you repeat once more, ma'am?
Can I repeat once again? That is why your request is right?
Yes.
Yeah. So see here where that systemic, this is our systemic circulation, no?
Yes.
Our that upper part of the body, so the impure blood will be collecting by the superior vena cava. Okay, so here the communication between the venous circulation, venous capillaries and the arterial capillaries are together, and from the right ventricle, it goes to the lungs. Okay, the impure blood goes to the lung for purification of blood now into the lungs. So here also there is a connection between the arterial capillaries and the venous capillary. So that's the same thing happening into the tissues too. So here the arterial capillaries and the venous capillaries are communicating together throughout the tissues. There is happening that because they finally the deoxygenated, where did the deoxygenated blood origin? That is the main question. You have to think about that. From the connecting to the small connections, it goes to the superior vena cava or the inferior vena cava. Okay, so here into the tissues, there is a connection between the arterial capillaries and the venous capillaries. When the arterial capillaries and the venous capillaries are communicating together, there is a leaking out of fluid-like materials into the interstitial space. That is called lymph. That fluid will be absorbed by the lymphatic capillaries. Okay, the greenish color is the lymphatic capillaries. The lymphatic capillaries absorb the lymphatic fluid into the interstitial space, and then it goes to the lymphatic vessels, then it goes to the lymph node, and then it goes to the lymphatic vessel. Finally, it goes to the subclavian vein. Okay, so how the lymphatic system works. So this is very, very important. As I mentioned earlier, whenever the arterial capillaries and the venous capillaries are communicating together, there is a chance of leaking out of fluid into the interstitial space. That fluid called lymph. That lymphatic fluid is absorbed by the lymphatic capillaries, and then it goes to the lymphatic vessel. Then it goes to the lymph node. So what is the function of lymph node? It will be, the lymph node will filter out the harmful substance. Okay, throughout the lymphatic system, because the lymphatic capillaries are more permeable than the blood capillary, because it has a blind end. Wherever the lymphatic fluid origin, they will collect, they will absorb, because fluid might be contains bacteria, virus, or waste products. So we don't know that lymphatic system, the lymphatic capillaries don't know whether the lymphatic fluid has bacteria, virus, or waste products. Okay, so after that, what happened? The lymphatic capillaries will drain the fluid into the lymphatic vessel. From the lymphatic vessel, it goes to the lymph node. Into the lymph node, it will try to filter out the harmful substance. There is a filtration happen. Okay. So the lymph node will try to filter out the harmful substance from the lymphatic fluid. Then it goes to the lymphatic vessels. Then again, lymphatic drug, collecting drug through that subclavian. Finally, it goes to the subclavian vein. So this is how the lymphatic system works. I hope your clarification, your doubt is clear.
Yes.
So here we move on to the lymphedema part now. If there is any damage, so now we learned about how the lymphatic system works, how the lymphatic system functions, what are the major functions of lymphatic system, what is lymph, these all things we learned. Now we have to learn about what is lymphedema. If there is any damage into the lymphatic system there is a chance of accumulation of fluid into the interstitial space. Okay, so imagine if there is any the tumor, like a breast, there is a tumor develop. What happened? They have to undergo a surgery like total mastectomy done. They need to done. So if there is a total mastectomy done, what happened? The surgeon will remove the adjacent lymph nodes too. Okay, what is total mastectomy? Remove the breast and also the adjacent, removal of breast and the adjacent lymph nodes are called total mastectomy. So what happened if the adjacent lymph nodes are removed? What happened? That lymphatic fluids will be stuck there because there is no lymph node in there into their axilla. Got it? So there is a connection. The connection is lost because the lymphatic fluid will be collected. There is no way to go up to the fluid from the lower part to the upper part. Okay, so here you have to understand that if there is a connection, if there is a damage or any problem developed into the lymphatic system there is a chance of accumulation of protein-rich fluid into the interstitial space. That time the lymphedema will develop. So here the imbalance between the interstitial fluid production and transportation, because here the fluid production will be there but the transportation is lost. So next, so classification. According to the International Society of Lymphology, it has two classification, primary and secondary. The primary kind of classification is congenital lymphatic dysplasia because from birth itself, the lymphatic system, malformation of the lymphatic system, it is called primary lymphedema, that congenital lymphatic dysplasia. Coming to the secondary lymphedema, secondary thing, anatomical obliteration of the lymphatic system. So if there is any problem developed in the anatomical part, like lymphatic system, the patients will develop lymphedema. Again, the secondary lymphedema divided into two group, non-malignant and the malignant. Okay. So from this slide, you have to understand that non-malignant persons can also develop lymphedema because on major road traffic accident. So that time, if the lymph node, the major lymph node will be damaged, there is a chance to develop, that persons will develop a lymphedema later. And major burns, infection, recurrent infections, it will be affecting the lymph nodes. Iatrogenic, like surgery or radiotherapy, so it will be affecting the lymph nodes. Coming to the malignant part, primary lymphomas and secondary is recurrence. So these are the classifications of lymphedema. Coming to the diagnosis. So we need to, whenever you have seen a patient with lymphedema, like any edema, you have to assess well and make sure that whether the patient is having lymphedema or other edema. Okay, so how can we diagnose the lymphedema? The first one is history. You have to take a proper history of the patient, whether there is any unknown cause, is there is any disease related or trauma related, or is there is related to treatment related. So now we learned about, so what are the causes, what are the classification of lymphedema, what are the primary, what are the secondary causes of lymphedema. Again, the secondary lymphedema divided into two, non-malignant and malignant cause. So you have to check if there is any problem. Then you can, after taking thorough history, then you can move on to the clinical examination part. So after taking a proper history, you will get an idea how the patients will develop edema or what is the cause of developing lymphedema. Because if the patient is having renal problem there, definitely that patient develop edema. So that is why we need to check. You have to take a proper history. Coming to the clinical examination, the first stage is pitting edema. So look like a orange peel skin. If this is the stage 1, that time if you apply pressure on that area, you can see your finger point there. So this is the stage 1. The stage 2 is tissue have become fibrotic or hardened. If you are not give a proper attention to the stage 1 lymphedema, so that time it become fibrotic or hardened and the tissues are no longer soft. So again, if you are not giving attention to the stage 2 lymphedema, it goes to the stage 3. The tissues are considerably hard and cartilage formation will be there. So next, so only one sign we can see in lymphedema is stemmer sign. So stemmer sign is when if a patient is having lymphedema, you can check this. In a healthy person, we can able to pinch or lift up the base of the second toe. So for a normal person, but so if there is a lymphedema present, this stemmer sign will be always present because you are not able to lift out or pinch out the second toe skin. You can see that picture here now. This is for the lower leg lymphedema. If the patient is having upper limb lymphedema, so you can see you are not able to pick up the fold of the skin over the proximal phalanx of the the middle finger for the upper limb. So this is one of the sign which we have seen in lymphedema patients, tremor sign. Coming to the other diagnostic methodologies. So in palliative care, we always take a proper history and then we will do the clinical examination. Then we will come to the diagnosis. Okay. So here there are other diagnostic methodologies are there. So you have to just understand that soft tissue imagining MRI CT, you can if you do that, you can able to determine the extra fluid volume. Okay. So the next thing is lymph vessel imagining. You can able to detect the abnormalities. Then bioimpedance spectroscopy. Then you can able to measure the interstitial fluid volume. So here, if there is a primary or primary lymphedema, like a congenital abnormalities there, then you can understand that what is the happen, what is the actual problem. Then you can do these all diagnostic methodologies, because that will help to understand the extra fluid volume, whether where is the abnormalities, and we can able to collect that measure the fluid volume level also. But in palliative care, these all things no needed because most of the patients are in N, and also for the CA breast persons, definitely we know because of the removal of breast and adjacent lymph nodes, that patients will develop lymphedema. So they no need to do these all investigation for that patients. Coming to the problems. Just imagine your one limb is normal and the another one is huge because of the fluid overload. Just imagine what are the problems will develop. Pain and discomfort. Our skin will be stretched as much as possible, but after that, the patients will feel pain and they experience pain and discomfort also. They are not able to heavy they are not able to carry or lifting their own limb because of the heavy weight. And heaviness, tightness, fatigue, numbness, impaired mobility, loss of functions. These are the physical problems, because of the immobility, they emotionally they will affect, because they are not able to lift their limb independently. If they want to take a thing from the cupboard, they need to depend others. So that all things affected them emotionally and spiritually also. Coming to the social, psychosocial problems, body image. So this is one of the huge problem, because one limb is normal, the another limb is huge. So wherever I have seen many patients, whenever they come to us, they will cover the whole limb with their own clothes, because nobody's show their different types of hands to others, because they feel more emotional, they affected emotionally and spiritually too. And loss of independence, as I mentioned earlier, they need to take up things from the cupboard, they need to depend others because of the heaviness. And loss and change of employment. So because of this disease, they are not able to work that previous job. They are not able to continue the previous job. They have to discontinue the job and go for another works because of the disease. So these all things will be affecting the patients emotionally and spiritually. Difficulty in wearing clothes and shoes, because one limb is normal, the other one is big. So if they want to wear ready-made clothes, they are not able to. And just to think about shoes, one leg is normal, the another leg is huge. They are not able to wear the shoes. So these all things will be affecting the patients. Anxiety, depression, social isolation because of these problem. Society or friends or relatives are not willing to come to see these persons. These all because of the problem. They might be have a misconception of disease. Might be they sometimes they might be thinking like that disease will be spreading to others. So these kind of things will be there in their mind always. So because of that, they will reluctant to see these type of patients. That will be affecting the patient emotionally too. So because of that, sometimes family isolation is also there. The family is also keep the patient in the side room and not allowing the patient to get out of the room and keep the patient always there. That kind of things. And the finally constant reminder of disease. So this is very, very major problem because whenever a patient come to you with lymphedema, they might be thinking like, especially CA breast patients, they might be thinking like, okay, my disease is spreading to my hand too. So we all know that because of the absence of lymphatic system, because lymph node, that lymphedema is developed. But they might maybe thinking like, they always think like, okay, because of my disease, my disease is spreading to my hand. If you listen to their problem, definitely they will tell like this only. So you have to listen their problems first, and then you have to make them understand why the lymphedema is developed. So you have to teach the caregivers and the patient about how the lymphedema, lymphatic fluid virgin, and how the lymphedema is developed. Then only they will do a proper management to the that area. So coming to the management part. So here now we understand that if there is any damage or any problem into the lymphatic system there, definitely there's a lymphedema is developed. So there are four major principles of management of lymphedema. One is skincare, the second is massage, third is compression bandage, fourth is exercise. The fifth one is intermittent pneumatic compression pump. So I'll discuss you later about that. So there are four different four principles of management of lymphedema: proper skincare, massage, compression bandage, exercise. So before giving that massage, you have to take a measurement. So here we have to take why we need to take a measurement. We need to measurement for both limbs, affected and non-affected limb, because we need to compare what is the difference between the normal limb and the abnormal limb. So here you can take measurement from the the ulnar bone, tip of the ulnar, and then head of the ulnar plus 2 centimeter, then again 4 centimeter. Every 4 centimeter you have to mark down first, and then you can take the circumference. Then for the lower limb also the same, from the angle joint plus 2 centimeter, then every 4 centimeter you have to mark it first, and then you can take the circumference. Coming to the skincare. So before moving to the management, like manual lymphatic drainage or simple lymphatic drainage, you have to you have to teach the patient about what are the special attention needed for that area. So skin care is very, very important, because if there is a lymphedema there is a chance of infection. Okay, so always they will apply simple moisturizing cream before massaging. Okay, not just before massaging. After bathing, they can apply. So just before massaging, it should not, because that friction is that fluid. If you do the manual lymphatic drainage, you are not able to move the fluid from one part to another if you apply moisturizing cream just before massage. So in between the digits, so there is a chance of accumulation of dirt because of the edema. There is a chance of dirt accumulated in between the digits. What happened if there is a dirt accumulated in between the digits? So fungal infection will be there. So they have to give a proper attention on that area. Avoid injection and venipuncture on that area. If you do a venipuncture or that injection on that area, what happened? So nothing happened. Sometimes nothing happened. But if there is a unhygienic practice or any infections there, definitely the cellulitis will be there. Even a small cut there, so there is a chance of developing infections. So don't give injections or venipuncture on that affected limb. Avoid rushes, avoid blood pressure cuffs because it will affect the collaterals. Avoid injury. So like most of the women are working in the kitchen. So sometimes it might be happen, but you have to tell them if there is a cut happen, they have to give a special attention on that area. So if it is happen accidentally, they have to keep that area clean and dry. If they have any signs and symptoms of infection or inflammation, they can go to the doctor and take a course of antibiotic. Otherwise, cellulitis will develop. And another thing is avoid carrying heavy things. So if you take a heavy things that affect the limb, what happen? Again, the blood circulation will improve and increase, and then the fluid fluid, the lymphedema is also developed. Okay. And the next thing is avoid prevent heat. So if you give a heat to that area, again that blood circulation is increased, and that way develop lymphedema. Coming to the massage. There are two ways of massage: manual lymphatic drainage and the simple lymphatic drainage. For the manual lymphatic drainage, one of the trained persons can do. Okay, you can start with a deep breathing exercise. Okay, so why we take a deep breathing exercise is, if you take a deep breathing exercise, all lymph nodes will be stimulated because we have lot of lymph nodes in our body. Our aim is to push the fluid from the congested area to the non-congested area. Okay, if there is any break, any problem into one area, our duty is to push the fluid from one area to another area. So then after deep breathing exercise, what you can do is you have to stimulate the superficial lymph nodes. Okay, then you can stimulate the opposite side, like unaffected lymph node, because if you have developed a lymphedema on the right side right side hand, you have to stimulate the left side axilla. Then you can massage the proximal part to the distal part. First, you have to clear the proximal area, then goes to the distal part. Whenever you can apply massage pressure on that area, you have to apply gentle pressure because the lymphatic fluids are situated in the interstitial space. If you apply more pressure on that area, because of your pressure, there is a chance of develop more fluid. Okay, your simple stimulation is a movement is enough to move fluid from one place to another. Coming to the simple lymphatic drainage, simple lymphatic drainage is done by a caregiver or a patient. Okay, so they should not, the patient or the caregiver should not touch the affected limb. Okay, because they don't know how much pressure is applied for massage in the affected area. If they apply more pressure on that area, what happens? Again, the lymphedema will increase. Okay, if you do it in a trained person like us, nurse, doctor, or a physiotherapist, We all know that how much pressure is needed. Okay, so simple lymphatic drainage only done by the caregiver or patient. You can train the caregiver about that. They should not touch the affected limb, but instead of that, they can do the deep breathing exercise. They can stimulate the superficial lymph node. They can apply bandages. They can do the exercise. They should not apply pressure on. They should not massage the lymphedema site. Coming to the contraindications. So these are the contraindication of manual lymphatic drainage. Acute cellulitis. If there is acute cellulitis there, pain will be there, swelling will be there, numbness will be there, fever will be there. These all things will be there. That time you should not do the manual lymphatic drainage. At that time, our aim is to control the infection. You can give some antibiotics for that and control the infection. Next thing is renal failure. So if there is a renal failure there, what happened? We are going to push the fluid from the congested area to the non-congested area. So again, the fluid overload will be there. If there is a renal failure patient there, sometimes the patients will affecting with that. And unstable hypertension, severe cardiac insufficiency, hepatic cirrhosis with abdominal fluid like ascites, superior vena cava obstruction. These all things you can just imagine. If you push extra fluid from the one area to another area, there is a chance of fluid overload. So we have a video on that manual lymphatic drainage. I'm going to show you that video first, and then we can see the bandaging part. Hope the video is clear to everyone. Now we move on to the next part. After giving a massage, after done the manual lymphatic drainage, then you can give a bandage. So you can apply multi-layer bandage or spiral bandage for that patient. So our aim is to push the fluid from the edematous area or the congested area to the non-congested area. So after massage, you can do the bandaging, and then you can teach the patient about exercise. How we can do the bandage? You can take a crepe bandage for that, and before applying a crepe bandage, you have to protect the skin with a small thin layer of cotton layer. So that sometimes that some patients have an allergic reaction with this crepe bandage. That is why we have to protect their skin well before applying the scrap bandage. So initially you can wear the spiral bandage. You can put spiral bandage to the patient because of the body that fluid. Sometimes the patients are not tolerate well. If the patient is tolerate well with the spiral bandage, then you can move on to the spiral that figure of eight bandage. That is multi-layer bandage. If you do it in earlier stage, multi-layer bandage, sometimes they may not be able to tolerate the multiple multi-layer pressure, and it will not sometimes they will stop the wearing of bandage. So that is why we need to train the patients gradually. Try to reduce the edema gradually only. First you can wear the spiral, you can apply spiral bandage. The bandage should be same for the upper limb and the lower limb, but for the upper limb you have to cover the finger also. Here also you can cover. If there is a small toes there, you will not you are not able to cover because of the small toes. If the toes are long, you can apply bandage into the toes also. Because here we don't have a small the 2 centimeter bandages. Here in India, most of the place kind of bandages are not available. But the Western countries, they have the 1 centimeter and 2 centimeter bandages that will be helpful for the finger bandages. But what we do is we take a 6 centimeter bandages and fold it into two, and then we will apply on the fingers. Here, lower limb also, after first we will apply a spiral bandage. After that, we will send them back to their home. So maybe a next review within 2 weeks or 1 week. Then, if they have no problem, sometimes they will have some complaints. Most of the time they don't have any problems. After that, then you can we will give a multi-layer bandages. So we have a video on bandaging also. So before that, I would like to cover the exercise part also. After that, I'll show that video. So after bandaging, then you can train the patient about exercises. You have to encourage the patients, because after bandaging, the lymphedema site, the area is give a more pressure. That time, if you give that small exercise to the joints, so that will help to push the fluid from the affected area to the not affected area. Okay, one for fingers, one for wrist, one for elbows, and one for shoulders. If they are able to do it, they can you can encourage the patient to do it. But if they are not able to do it, you can train the caregivers to give the passive exercise to the patients. Our aim is to push the fluid from the one area to the another area. Always they have to wear a compression garments. Like sometimes some patients are using some stockings. So if they are able to wear the stockings, they can wear stockings also. If they are not able to wear stockings, then you can apply bandages, scrub bandages. So after bandaging only, you can educate the patient to do the exercise. So without bandaging, if they do more exercise to that area, there is a chance of developing more edema. Here also, heavy lifting is not recommended. Only simple exercises are recommended. Coming to the intermittent pneumatic compression pump, this is a stage 1 lymphedema stage. As I mentioned earlier, there are 3 stages of lymphedema. The first stage is orange peel skin, like a pitting edema stage. That time, the intermittent pneumatic compression pump will help. So here you can see like a BP apparatus cuff. This kind of cuff will be there. The plastic garment like there. You can insert the affected limb into that garment, and we can able to. There is a small machine is there. So like a air mattress machine. So we can able to adjust the pressure on that machine, and you can adjust the duration also, 30 to 120 minutes per hour. That kind of things you can adjust. Then you can leave the patient there. Okay, so after that they can go. This will give a continuous pressure to the affected limb. So if you give a continuous pressure on that area, what happens? That lymphatic fluid will goes up, moves up. Our aim is to push the fluid from one area to the another area. So there is a break. Okay, so our aim is to push the fluid from one area to another. So this will be helpful for that situation if there is a stage 1 lymphedema. Otherwise, it won't help. So coming to the complications of lymphedema, there are 2 major complications of lymphedema. One is cellulitis. Cellulitis is it is an acute inflammatory episode, infection of the skin or the subcutaneous tissue. It could be streptococci or staphylococci infection will be there. If there is a signs and symptoms of infection, pain, swelling, warmth, redness, anything there, you can give some analgesics for that. That the good antibiotics, analgesics as well as antibiotics. So antibiotic is the must one here. Amoxicillin is the good antibiotic for this condition. You can encourage the patient to see a doctor and make sure that they have taken course of antibiotic. So our aim is to reduce the reduce the cellulitis. So coming the second thing, complication is lymphoria. Lymphoria is leakage of lymph from the lymphedema site. That is lymphoria. Okay. So there are two complications. One is cellulitis. If there is a cellulitis there, you can give an antibiotics for that. If there is a lymphoria is leakage of lymph from the lymphedema site. That time you can apply adherent dressing to the leaking area and give a crepe bandage. You can apply pressure bandage on that area so that all excess fluid will come out. Okay, so this is the management of lymphoria. So I will show a video on the bandaging. After that, I'll take few questions. Okay, thank you. I hope it is clear to everyone. Any questions there, please ask. Anybody? Any questions?
Please show that articles, bandage articles once again.
Bandage articles. Do you want to see the video again?
Video, no, that things, articles, how many are there? I could not catch.
Yeah. So
Bandage, 2 inch.
for what? Bandaging, right?
Yes, yes.
Yeah. So we need a cotton layer. The thing, cotton layer, thin cotton layer, and crepe
Yes.
bandages 3 centimeter.
Okay.
Or if you have 6 centimeter, we can fold it, fold the 6 centimeter bandage and make 3 centimeter thing. Then that
Okay.
you can use for finger bandage.
Okay.
And you need a 6 centimeter bandage for spiral bandaging, and then 8 centimeter bandage.
Okay, ma'am.
If you have a 10 centimeter bandage there, you can use that. Our aim is to, for the spiral bandage, 50% overlap should be there.
Okay, ma'am.
The same thing we need for multi-layer bandage, like a figure of 8 bandage.
Okay.
The procedure step is different from the spiral bandage to the figure of 8. That is the only difference.
Thank you, ma'am.
Okay. Yeah. So one question, nowadays upper arm compression garment or stockings to prevent edema also available in market. Yes. As I mentioned, I think I mentioned it during the classroom session, stockings. There are stocking for lower limbs and upper limbs are available. But the thing is, if you don't have a unilateral edema, you don't, you are not able to wear it. If you have a unilateral lymphedema, then you can wear the stockings. But it is available, but the thing is too expensive. If the patient is not affordable, they are not able to buy it. So that time we used to use crepe bandages. Tibakar, yeah, okay. So Sister Anita, say what ointments use? So here we use white petroleum jelly, Vaseline, like white petroleum jelly. If white petroleum jelly is not available, they can use coconut oil. Our aim is to keep the lymphedema area moist. that give some, if there is a dryness there, that we need to prevent it. Any other questions? So how long we can keep the bandage or change? So here, if you do the, if you give a crepe bandage, if you give a spiral bandage or multi-layer bandage, fear of fate to the patient, once the edema reduce, that finger, the bandage will start to loose. Gradually the bandage will loosen. Okay, so here we used to do say the patient that whatever time they can keep, because sometimes we used to train the caregivers to apply wear bandage, because after 2 hours that big bandages will loosen. So we used to train the caregivers to how to apply bandages, and they will, if the bandage is loosened, they will apply. The caregivers will apply wear the bandages. Okay, so here we don't have the app time. If you use the stockings, better you can remove at night, because if the edema is comes down, the stockings will give more pressure on that area, because that is more that elastic, that power on that the stockings, because once the edema is reduced, that stockings will give more pressure on to the tissues, and it will affect the circulation. During the sleeping time, they will remove the stockings. But here we don't have a at that particular time. Whenever they want, they can wear it. They can wear it. If they want to remove it, they can remove it. So definitely after wearing a crepe bandage, after 2 hours, definitely the bandage will loosen. This is my experience. We used to use crepe bandage only. We don't have any stockings. If the patient is affordable, we will use stockings. We will we will get the stockings and wear the stockings for the patient. Any other questions? So can we hang the hand tied with the IV stand to reduce edema? No, we don't. So how long you hang it? That is not possible, Divakar. What you can do is after bandaging, you can do the exercise, and then you can keep the affected lymphedema area just above the shoulder. That height, because you can keep a 1 or 2 pillow under the arm, so that is enough. That time the fluid will drain. Got it? If you give a just above the shoulder head, that the gravity, because the gravity is up to down now, so definitely the fluid will drain from the upper part to the upper portion to the lower portion. Any other questions? So thank you for asking these questions. Very good. Again, ice application, no, it will not help. Ice or diuretics, it will not diuretics, and these kind of therapies are not helpful for this kind of situation, because there is a the fluid is into the interstitial space, because of wherever the arterial capillaries and venous capillaries are communicating to the lymphatic fluid is there, so it will not reduce with the diuretics or any other methods. Only ways to move the fluid with your pressures, because our you can just, the fluid is into the interstitial space only. You can just give a small pressure, gentle pressure is enough. Okay. Any IV antibiotics to reduce edema? No, it will not. It will not help. If there is a infection there, cellulitis there, then you can think about antibiotics, oral antibiotics or IV antibiotics. But if the lymphedema will not heal with any antibiotics, only ways to reduce the edema with manually, no other way. There are other methods. Day before yesterday, one surgeon told me like there is a procedure like connection between the interstitial space to the venous area. So there are options are available, but it may not success. Sometimes it will help. There's a lot of overall in our body there are a lot of in our whole body within the tissues that fluid will be drained. No fluid will be there. So where so it will not help. How much fluid intake is allowed? Fluid intake and output is not there is no connection is intake and output. This is about the lymphatic system only. There is no connection between intake and output. This you don't connect with this intake and output. Whatever you want, they can take. If they have a renal problem there, they can take an advice from the urologist, and that amount they can take. Otherwise, no fluid restriction is needed for lymphedema patient. Why heat application is prohibited? If you apply heat applied on your body, what happened? Your blood circulation will increase. Your blood circulation is increased. What happened? Your arterial capillaries and venous capillaries are communicating together vigorously because of the increased blood circulation. So that is why the heat application is prohibited. Here, the same thing, massage. If you do the massage for the bed sore patient, like prevention of bed sore, we used to give a massage to the patient. So our aim is to improve the blood circulation. Here, if you give a good massage to the patient, that lymphedema area, what happened? The lymphatic capillaries, the arterial capillaries and venous capillaries communicating together and again drain more fluid into the interstitial space. Okay, so that is why this gentle pressure, we have to apply gentle pressure on that area. Your gentle pressure is enough for moving lymphatic fluid from one place to another. And also, if you apply more heat on that area, again, there is a chance of developing more edema onto that area. That is why heat application is prohibited. Thank you. Think about that. Just wherever the venous capillaries and the arterial capillaries are communicating together, there is a oozing out of fluid, that is lymph. If there is any damage into the flow of the lymphatic system, that fluid will be collected. Fluid is collected to that particular area. Okay. So that is why you have to keep it in mind about that. Any other questions? Jessie ma'am, any other questions? Mamta, any questions? Mahbub ma'am. You're muted, ma'am. You are muted, ma'am. Mahbub ma'am, you are muted.
No questions, ma'am. Understood everything nicely. Thank you.
Okay. Any other Rita ma'am, Shanti ma'am, Mamta? No. Okay. So if you don't have any questions, we can wind up the session. If you have seen lymphedema patients, please try to give this kind of management to the patient. If you have any doubts, please call me. I will come to the video call mode, and then I'll talk to you. So you can just if any doubts on that, please take a picture on that area and then send to me, and I will help you. Okay. Anytime you can call me. Thank you so much. We can wind up the session. Thank you for attending this session. Thank you for your contributions and asking questions and clarification, clarifying your doubts and all. See you in the next day. Thank you all. Thank you.
Thank you, Sheeba ma'am, for your nice tutorial. Thank you everyone for joining us. Thank you. Bye.